Hello, everybody. Good evening. This is Dr. Rao. I was speaking on this topic, true yoga and true benefits, in on LinkedIn audio at the request of one of my friends. Um, so we felt like the 1 hour was not enough to talk about that. So I thought I will continue in my room. And for those people who are interested, they can listen to the replays. And if they come here, they can always participate too. So I was just continuing from this morning where we talked about uh, how yoga made a place in my life and how it is benefiting me, how we can incorporate it modern health care and really accentuate the benefits that you could get from the yoga practices. It's more like a lifestyle rather than any religious or spiritual process for a lot of people. That's okay, but originally it was supposed to be for spiritual enlightenment, but then now it has tapered down to a lifestyle where people can enhance their health and general well-being, and also really cut down the duration of the disease or recovery period from surgery, enhancement of improvement as an athlete in any sport. The beauty about yoga is you can customize per sport, you can customize per age group, you can customize for the gender, you can customize for the weather, and you can customize for different types of bodies, right? So it's a very malleable, very important important uh, daily thing that you could incorporate into your daily life, which will enhance your life in so many ways, right? For example, if you are asthmatic and you have problem with a lot of breathing problems, you can address that with good practice of pranayama, which will really enforce a lot of vitality into your breathing, and thereby the breathing really helps a lot, right? That's very important for them because they have what are called pearls of Lanak. They're like an inspissated mucus that is really losing the water. It becomes like a plug that blocks the airways. So we usually give them some extra water and extra uh, humidity and all that, right? They can, but then this deep breathing really promotes to bring those kind of blockages out, and that is a very good thing for the asthmatics to feel good about it. So like that, you can really present a lot of things that people can do, right? Any disease. For example, somebody has a knee surgery, knee replaced, and then he comes to me. Generally, what I do is I will give them my own physical therapy exercise based on yoga. So they can continue the physical therapy, but then whatever stretches they have learned, whatever stretches with breathing they learn really enhances their recovery, and so they cut short the number of days that they require to come back to work or to come back to functional walking and all that. So a lot of hidden benefits. It all depends upon how we kind of employ those measures for the patient's routine, and then they can safely do those things. But you have to have understanding of what kind of muscle groups are affected, what kind of breathing they should be doing, what kind of intensity that they could do, what kind of asanas they can do. All that varies according to the person, according to the age group, according to the sex, according to the uh, general pre-existing strength of those people before the surgery. All those things are factors. But basically, you can customize these exercise routines for people from childhood to very, very old people. Okay, and so that they can do them safely and they can get the benefits. Okay, So true yoga really is more like a very important and more significant in anybody's life. That's for self-enlightenment, self-realization. A lot of people may not know about it, may not want to do that much about it, but then you can do it at a physical level, at the mental level, at the relaxation level, at really addictions can be treated. So many varieties of ways you can use yoga, right? So that's why it's important that you understand uh, the malleability of yoga and usefulness of yoga in several life situations, right? Um, for my story, I was brought up in India. Uh, not everybody does yoga there. It's a fallacy. Most of the people do not even know what is yoga. But then the people who do vary from very advanced practitioners to maybe somebody is doing once a week or something like that. Okay, ours was my first introduction was to this one class, 1 hour class that we had. We call them physical education person there is called a drill master, right? And he used to conduct that class, and then he showed us the postures, and then he asked us to do them. We were very young, our bodies are very flexible, and so we used to do that, and then we kind of understood some of the asanas from him, and then we used to practice on our own. So that was not the way yoga is supposed to be. Yoga is supposed to be under a qualified master, not qualified according to some hours and all that, but really understands yoga from his teacher, who was a genuinely knowing the yoga and all that, and then you learn and then you practice according to your need, right? And then you go from there. But then after I came from India and United States, because I was exposed to a lot of stress in my residency, I kind of looked to yoga to give me some relief, which it did, And from then onwards, I took more interest than normal. I wanted to study what are the healing systems of the ancients. Ancient. I got hooked to that, and then I began to study. I went pretty deep and wide, learning about these healing systems, be yoga, be it be Ayurveda, be it be Vedanta philosophy, Advaita Vedanta philosophy, and all those, right? And also reading Krishnamurti, reading Eckhart Tolle, Bruce Lee. So many varied of people really look at ancient wisdom from India, from China, from Egypt, from Japan, from Central America, from Africa, from United States. All the everybody carried their own ancient history, which is very beneficial for us. Okay, I think it's unfortunate the scientific community don't take as much interest in that as they should. I think some of them are really doing a good work, be it be yoga benefits, be it be consciousness studies, be it be enhancement of human being, any number of areas they're studying ancient wisdom, wisdom as a whole, and they're getting a lot of benefit out of it, and they're bringing a lot of, for example, meditation. Dalai Lama, he is working with some Western scientists to study mind when the meditation is practiced in Tibetan Buddhism, right? That's also one of the very well received philosophy, not only in the East but also in the West, right? So these two philosophies, Advaita Vedanta and Tibetan Buddhism, okay, these two are very much valued by scientists, right? And now they are conducting a lot of studies on effect on the sleep, effect on the mind, effect on the heart, effect on the burnout and stress. So many number of areas people are studying them. Um, I kind of get the benefit because I already was sold on the efficacy of these things because they are natural, first of all, and I don't have to take any medication or any kind of thing into my body. I need to understand, and I don't have to blindly believe them. I can question, and then I can understand. I can come to a real conclusions about it after my investigation, and then I can adopt it, and then firsthand I can see how much beneficial these things are for me. For example, my energy is very high, and I don't take any medications. And I do have a lot of enthusiasm for a lot of things. I participate in the life like that, and I sleep very well. Even though I sleep only a few hours, I sleep very well. When I wake up, I have full energy, and I do have these creative urges. I do a lot of creative stuff. So I don't see anything negative about it by changing my lifestyles to more like what is called sattvic lifestyle, yogic lifestyle. What it is you take balanced food. You are a vegetarian, so you don't harm any animals, and you create less waste, and then your need for consumption of so many resources of the earth goes down. That way you can help the planet to rejuvenate itself, and you kind of relate well with the family, with other people, and you relate well with all the people that you encounter with. They may have hang-ups, but you don't have it in your heart. I see a lot of people on the social media that have their own hang-ups. They may be prejudiced against these ancient wisdoms because they think they are superior. Right? That is like ego talking. But that is their problem, not my problem. So I don't force anything on anybody. I just come and discuss and give out my insights. And then if they want, they can always talk to me. They will always invite me. If people invite me to their groups, I go and talk to them once or twice. And if they want me to go and tell them everything, they will do all of that. That's difficult. If they are interested, they can always come to my rooms, and then they can participate in this discussion and learn them. And also, whatever I talk, I record and then release it there, so people can go there and find some information if they want. If they want only information, if they want transformation because of this thing, then they have to look their own teacher or come to my offerings of wellness club, my ebooks, my courses, my presentations, my webinars. They're all there. They can come and join them. So when I was growing up, as I said, that was the only exposure. And then later on, we were not introduced in the medical school, and it was all study, study, study all the time. So we never really had any time to do anything else, right? So once that is all done, once I came here, then I felt the need for the stress reduction aspect of yoga, because I was stressed. I was suddenly promoted to a big job, even though I was young. I was only 27. But then I don't know, somehow they gave me that, and that gave me a lot of responsibility, and along with it, a lot of stress. So after I started breathing practice, I started yoga postures. Things have really turned around so that I don't have to be stressed so much, right? But I didn't know much more than that. So I used to bike. I used to go on the lake and really go on the bike for long distances, and that kind of things all helped, right? And then later on, I started my own practice. In the practice, my dictum was attend to the disease origins, not just the disease process. What normally happens in medical school and residency is they teach us about how the disease comes up, how what kind of things we can do, whether how the disease process is called pathophysiology, we say, and the course of the illness is certain way, and then we understand that we treat that, right? But we don't really attend to the cause of the disease. That is what I wanted to focus on, disease origins. So, for example, somebody comes with diabetes and diabetic coma or decay, we put them in the ICU and treat him for a couple of days and reverse that high blood sugar, ketones, and all that. It takes a lot of money, like 1,000, $1,500 per day that we have to spend on each patient. And then he goes back home and he starts to do the same kind of mistakes of diet, lack of exercise, restless mind, lack of sleep. All these things are pretty bad for diabetes to manifest, right? So we want to educate and be aware of the what can happen if you don't change the habits, food habits and exercise habits and all that. So that is where we are attending to the disease origins. What is really making this really grow, right? So yoga is for that too. So we combine that. We make sure that they know and they can do a lot of exercise, a lot of stretching and breathing, and maintain the energy and not be reactive but more responsive. All those things come into place, right? Then people feel much better and they come out very well. So we are going to that place where we are going to tell people what they're going to manifest as a disease in 10 years down the line from the blood test that we can do now, right? And then they can take care of their bad habits or lack of habits, and then really put in those good things into that life. Okay, that seems to be the difficult thing for a lot of people because they want to do it at the behest of somebody, or somebody is giving them elbow. They do it for the day and then they forget about it. Instead, if you investigate and find out what are the causes of this particular disease suggested by the blood samples, all that, you can treat yourself better. Okay, ancient systems are good at that. They are very good at whether you are natural or not. If you have deviated from the natural, how much deviation happened from the natural state to the disease state. And then reversing them and also at the same time treating the disease is the key. What we do as physicians is we treat the disease, but we don't advise you about how to protect yourself from further attacks and all that. And more doctors are doing it now, but at that time I was trained, we were not trained all these things. But as I implemented them, as I asked people to follow them, the results that they had really showed that they were doing very well with this incorporation of the hacks of the ancient wisdom into modern treatment routines, right? So we began to see we were able to cut down the medications of our patients. Instead of 40 medications, they have only 10. Instead of 10 medications at very high dose, they have half a dose, something like that. But it doesn't happen just like that. It takes a long time. It takes a long understanding both on the part of the patient and the physician, and also constant monitoring. So it's a low tech but very important, right? You got to remember what is working, what is not working, and then maintain that slowly. Okay. So you cannot have everything done the next minute. Like people are now used to instant gratification. That doesn't work in long-term healing of chronic conditions. You got to have the patience, you got to have the training programs, and you got to adhere to those training programs as much as possible. Okay. So that's what happened in the beginning of the early part of 80s when I was really stressed. I got into BK Sengar, yoga, and all that. That really changed my life. And from then onwards, I carried this disease origins perspective in my medical practice. And also we kind of had evening sessions of yoga practices with people who want to do them in our waiting room after hours. At 5 o'clock, we used to close down the office, and then 5 to 6, we used to open that waiting room for all the people who want to come there. Obese people were there; they were coming together. So we taught them a lot of this yoga, a lot of breathing, a uh, lot of breathing patterns and all that, right? And they were very happy about it. And also they had a lot of questions how to lose weight and all that. So when they are doing collectively, it made a lot more sense for them. We had people with the difficulty breathing. we had people with all sorts of pains, neck pain, back pain, knee pain, any number of different varieties people have showed that they are vulnerable, right? So we used to give them special status, special group where they can talk about in our waiting room. And then I found this company called Be a Pal, which is like an online wellness optimizing company. So we basically train physicians and nurses for burnout. That's a major program. And then we also train the IT professionals for stress reduction because they have a lot of stress. And then we kind of teach corporate leaders about how to be a servant leader for their own all the people that they are serving, right? And then we kind of coach people about individual practice of yoga or group practice. We coach them on pranayama, that's the breathing exercises. We coach them on meditation, how to calm their mind, and we coach them on the nutrition, and we kind of coach them on public relations and all that. So any number of things we add value to their life because we are teaching them therapeutic lifestyle changes. So first look at the person, look at what the habits they have, what is he tolerated, addicted, and how we can reverse them so that he can go back to his natural self where he can practice these things and then get benefited from that. Okay. So that was going on with my company, and I was selling a lot of training spots for the wellness club. I deliberately put it like a nominal price because people can come and learn things and then go from there to other places and then really consolidate what they have learned. So that's one way I opened my practice. This is how we used yoga quite well. But then there's a spiritual angle in yoga where people can be self-realized, realize their true self within by calming their mind. So that is the real yoga. And then having this union between the universal consciousness and your individual consciousness, that's what they call yoga. Yoke from comes from yoke, right? Then people may not be interested in that because they're so occupied with doing stuff, they don't have time to be or being, right? So that's what we talk about in the media. I talk about in person with whoever comes our way, okay, right? So all these things are going on, and I'm very happy because these habits and these hacks, these shortcuts and all that come from something of a solid understanding, solid training of the ancient wisdom for me. So I still continue to learn. I still think I have a long ways to go, but whatever I have learned really changed my inner self. That is the purpose, inner change, inner understanding, and then really looking at things of what are the things that we need to change here, or we need to change ourselves so that this outward thing will be very good. That's very, very important. So that's what I wanted to talk about today. I just gave you just a brief assessment of how things are, how things can go. So after I established the practice, after I incorporated this yoga practice into my practice, it gave me a lot of dividends for my patients. They got better faster, they have quality of life, or they're playing something, or they're moving something, or they're sit down and reading and all that. Okay, so the quality of life has gone up, and they were able to cut down on the medications. They were able to stay away from alcohol, smoking, drug abuse, and all that. So that's a very important gain, I think. So I don't have any habits. That's why mainly because I want to understand this awareness-based system. I want to understand how these animals will have to control so much more. Okay, so that's about it for now, and hopefully you will all come tomorrow. Again, I'll take up this topic, and we can talk more on this. Okay, thank you.